My name is Peter Canilao. I was born and grew up in Barangay San Esteban in the town of Makebebe in the province of Pampanga. I have 6 children, all in the United States, 3 in Michigan, 2 in Las Vegas, 1 in California. I worked in the diplomatic mission in Washington, D.C., then moved to the state of Michigan and joined the St. Mary Hospital Financial Management Department. I retired as a budget manager. My other activities in my life, I was a past president of the Círculo Pampangueño of Michigan administrative year in 1991-92. Past president of Kiwanis Club of Westland, Michigan, 1985-84. I was an overall chairman of the Result Day Committee held at the Detroit Cobo Hall, Detroit, Michigan, December 30, 1985. And then I retired from my employer, St. Mary Hospital, after 25 years. Now, my children are in the United States, but I'm now enjoying my life in the Philippines. It's the best place for me, being a real born Filipino, although I'm a Philam, but I'm enjoying my life in the Philippines. And I appreciate the CSA for giving me the opportunity to be given the special treatment like this. A couple of weeks ago, I was given some shots to eliminate my eye bags, and I think it's now a follow-up again this time, as well as my forehead. I do not know what they're going to be doing because I'm not a doctor. But, hopefully it's going to be a successful one. That I understand these are all specialist people. We'll be right back.
Hi guys, it's me again, Carmina, and I'm just here to share how blessed I feel to be a part of the CSA family. Last time that I was here, I was able to try yung liposonics, which helped me get rid of some belly fat. Na ayun, thankful ako sobra kasi syempre sa age natin ngayon, yung mga babae, number 1 problem natin is yung sa tummy. So yun, ito yung result niya. And also, after a year since my last session, natulungan din ako ni Doktora sa face contouring, as you all know. And a couple of days ago, in-inject ulit ako sa masseter muscle ng Botox para ma-maintain yung face contouring. So, ayun. Thank you so much po, Dr. Contessa.
We're back mga ka-CSA. Welcome to the Certified Skin Authority. I'm Dr. Contessa, your certified aesthetic physician here at CSA Derm Center. In today's episode, we will be doing another periorbital rejuvenation. We have a first-time male guest in his 80s, and he would want to experience also a non-surgical aesthetic procedure. And today, muli nating makakapiling ang isa sa ating mga CSA models, Miss Carmina Joven. Welcome.
Oh, thank you
Welcome
po.
back. And of course, Mr. Pete Canilao. Welcome, Sir Pete, sa
Thank
CSA.
you.
Ayan. So a while ago, si Sir Pete already mentioned about a treatment we did like 2 weeks ago, sir.
Yes, a couple of weeks ago.
Yes. It was the rejuvenation po below the eye area because the concern was eye bag. Right, sir? So we did an injection of some threads. So Carmina, last 2 weeks, meron na kaming treatment kay Sir Pete. So ang concern kasi niya, yung dito sa ilalim ng mata. So,
as we age po, it's normal talaga na
Yes.
parang nagsasag, tapos
Nagsasag.
nagkakaroon ng wrinkles and all
Right.
that. But even
Lines.
if you age, you don't have to look old, diba? Parang,
Correct.
diba? It's really cool to find someone of his age po na talagang
Yes.
interested pa na
Sir,
rejuvenate.
Ilang taon na nga po pala? Exactly, ilang
Exact
anong
age
age?
I just turned 83 last August 3rd, instant
Yan,
of this year.
Wow.
So I'm going for 84 now.
They're very strong pa
83
eh.
years old, napaka-healthy po.
Still very healthy, walking every day.
Yes.
I stopped my golfing for a while.
Ayan po, amin naman pinapakita sa inyo po na all ages tayo dito.
Yes,
Diba? Kahit po si Sir, nasa 80s na, pwede pa rin mag-undergo nitong mga non-surgical procedures.
Because it's that safe, diba?
Exactly.
And how are you feeling po?
Oh, very good.
Kamusta? Very good.
Great.
Yan.
And I appreciate I was invited back to
Yeah.
Contessa.
We had the photo, yung before photo ni Sir, yung pagka-puffy dito sa ilalim ng mata niya. And we did injection ng mga PDO threads, tornado eye bag threads. And we only inserted like 3 on each side. And kamusta naman po yung pagbabago doon sa treatment, from that treatment 2 weeks ago?
A little bit, it shrink a little bit. Particularly my eye bag, my left.
So meron ng decrease ng yung pagka-bag, yung pagka-puff nung kanyang sa ilalim ng mata. Yan. Kasi we only use minimum number of threads. Ngayon, follow-up treatment ni Sir. So, we'll be completing yung tinatawag na periorbital rejuvenation. Si Carmina nga, Sir, tingnan mo ang bata pa. Napakaganda ng eyes. Yan.
Thank you po.
Carmina kasi, she had liposonics po last time.
Yes po.
Ito po yung mga treatment sa areas na merong stubborn fats. Kung gusto
Yes.
nating i-melt, we can make use of that machine, liposonics. And naging effective naman, right,
Yes
Carmina?
po. Especially, kailangan talaga din syempre ng diet.
Diet, exercise,
Yes
yan. And also, yung maintenance na pang face contouring, yung ating
Yes po.
Botox.
Thank you so much
Yes.
po talaga dahil ever since, aminado naman ako, problem ko yung big face.
Yes po.
And ngayon po, di ba
Right.
parang ang uso kasi yung inverted triangle na
Yes,
face
or the
shape.
V-shape.
Yes
Yan
po.
po. Kay Sir Pete kasi, actually yung treatment kay Sir dapat yung mga yung restoration, rejuvenation. Although, na-share po niya sa akin na like about 15 years ago, he did yung upper eyelid blepharoplasty.
Back in Las Vegas.
Las Vegas, yan. So, nagkaroon ng cut dito, yung mga excess skin. Kasi as we age, nag-hooded eyes na tayo. Bumabagsak yung upper eyelid, yan. So, meron kasi kaming treatment na gagawin kay Sir ngayon, ating ipapakita, yung how do we manage yung itong nagsasag na brow or nagsasag na upper eyelid. So, we can do again non-surgical procedure making use of the PDO threads.
Okay.
Okay.
Wow.
Kasi actually sa age na po na ganito, Sir, I don't recommend much of using Botox sa forehead, dito sa yung mga muscles around the eye. Kasi nga yung muscles natin as time passes by, humihina.
Yes.
And knowing that Botox weakens or yun nga po, yung muscle ang natatarget niya, baka lalong maghina. So we just wanted to strengthen yung muscles around the eyes. So, ang
Parang
re-recommend ko,
support.
exactly, support. Yan, ang re-recommend ko will be threads again, dito, to lift the upper eyelid. And we will also add yung kanyang threads dito as a follow-up dun sa previous treatment. And a little bit of dermal filler. Okay, so atin pong ipapakita sa ating mga ka-CSA sa pagbabalik ng Certified Skin Authority. Hello again mga ka-CSA. We are now at the part of the actual procedure for periorbital rejuvenation for Sir Pete. So we'll be starting on working here below the eye area. Last 2 weeks, we did the injection of PDO threads. We made use of 3 tornado cannula threads on each side po. So, more than 2 weeks ago, no, Sir Pete?
Yes.
And right now po, actually ang na-notice namin na bawasan na itong pagka-puffy ng eye bag. So, this is a continuation of that treatment. We'll be starting with correcting yung tear trough niya using dermal filler. So, I have with me a Belotero Balance. Kanina po, we already cleansed the skin. Naglagay po kami ng topical anesthesia. Tapos po, I injected a few, like a 0.1 ml of the lidocaine. And right now po, I'll be making a point of entry. Yan. So, relax lang, sir. This is for the entry point lang po. Okay lang po? Okay. And then after this will be yung ating cannula lang for the insertion of the dermal filler. So I'm using a hyaluronic filler. It's a substance we find in our skin, in our connective tissue. Napaka-natural nito, sir. So safe na safe po siya. Well studied, US FDA approved. So right now I'm using a Belotero product. So I have a cannula. It's blunt, it's not sharp. So I'll just glide it into the tissues inside. Yan. So si sir, he had surgical blepharoplasty about 15 years ago, pero upper eyelid lang po. Pero napapansin na rin po yung pagka-hooded niya ulit ngayon. So some of the people na nag-surgery na rin kasi, they still come to us for a non-surgical treatment. Pwede pa rin po. Si Sir Pete niya, nagtatry na siya ng mga non-surgical techniques. Kasi noon talaga, sir, puro surgery lang eh. So, i-glide ko lang po siya towards the tear trough. Yan, okay lang po si Sir Pete. Napaka-healthy. Wala man mga ano yata maintenance medicine, kundi mga supplements lang, no, sir?
Meron konting supplement.
Konting supplements, yes. Ano pong supplement
Vitamins,
nila? Yan. Imagine, 83.
Yeah.
Napaka-healthy. Yan po. So, again, this is hyaluronic filler that I am injecting into the tear trough area up to the midline. Ayan po. So, just to give support, elevate po yung infraorbital region ng kanyang mata. Yan. Tinutulungan po natin na ma-support itong skin under the eye.
Okay.
So, ayan. Nagkaroon na po ng lifting. Okay. So, next po is I will add dun sa mga tornado threads. Last time po, this one. So, ang start namin is we give anesthesia na naman po dito sa gilid ng ating mata. Yan po, lidocaine ito para po hindi maramdaman yung entry point. O sir, this is again an injection of a lidocaine. Okay po, medyo ano lang po si lidocaine ng konti. Inhale, exhale po. Okay lang po yan. So, lidocaine injection for the entry point of our cannula thread. Again, we're using po yung mga PDO threads. Ayan po. So, kailangan natin yon para po magmanhid yung skin dito. Okay? So, entry point na naman po. Si Sir retired na for how long na po?
20, almost 26.
Almost 26. Ayan po. So, entry point ko lang po dito. Okay, this is a gauge 21 needle. So, we wanted to achieve lang is a rejuvenated eye area. Non-surgical technique po. As much as possible, we're very careful po. So, kasi si Sir in his 80s, hindi natin kailangan masyadong aggressive. OS, please. Yan. Minimal or pinpoint bleeding lang po. And then, this is again the Ultra V EYEBAG cannula threads or tornado threads. So, we already gave you po 3 cannula threads last time. So, we'll add, actually the maximum I can insert is 5. So, right now, we'll just adding. So, sometimes po I give this, like, nag-i-start talaga ako, 3 cannula threads lang po. Like kay Sir Pete, we can do a gradual procedure. Stage by stage procedure lang po.
Yeah.
So, I'm gonna glide the threads inside again po. So, the plane of tissues na pinapasukan namin, yung fascia sa loob ng ating ilalim ng mata.
Okay.
So, ang healthy ni Sir, healthy lifestyle kasi walang bisyo, right? At saka, healthy diet,
Oh yes.
exercise.
No pork sa akin, wala na yan.
Oo nga kasi nga, you had a procedure you were telling me before na laminectomy. Pero before you were playing golf, di ba?
I used to, not lately. After my laminectomy, I had to stop for a while. Apat na rin ka na akong golf set.
Yes, o ba? Pero sana po you could still return to that activity.
One of these days, I will gonna start at Policarpio.
Okay. So this is a tornado PDO threads again po. I'm just gentle po for Mr. Pete. Yan po. The purpose is to have the threads go inside, and then kailangan ko lang pong ituloy-tuloy up to the middle aspect po. And kailangan nating iwan yung threads inside. Okay po. I'm just gentle for Mr. Pete. Yan po. Kasi actually, I already inserted 2 weeks ago eh. Meron na po siya. Dinadagdagan na lang natin.
Okay.
Just to further decrease po yung pagka-puffy eyes. Yeah. So, I'm just gliding in, and then after that, remove na po. Ayan. Okay. Another one is, I'll be using my inch thread para po i-inject in the infraorbital rim, this part here, to give further support.
Yeah.
To the tissues here po. Yan. I've mentioned a while ago nga na sa age ni Sir talaga, less lang po ang injection ng mga Botox para po hindi masyadong mag-weaken yung inyong tissues around the eye. Kasi the problem of the others, when they inject Botox here, Botox there, Botox here, the more you cause drooping of the upper eyelid. So, right now, the remedy is to use PDO threads to uplift the brow and the upper eyelid. And also, we can make use of filler on the temple region to uplift the lower eye area. Or yung ating eyelid, pwede ring ma-uplift or ma-minimize ang pagka-eye bag when we do also filler on this side. Okay po. So, right now, I'm seeing an improvement. So, I had filler here. I had the tornado thread here. Now I'm using inch threads. Okay, this is an inch of the PDO threads. We'll use it for the below the eye area po. So this is just injection like this po. Inhale, exhale. So this is done by trained physicians. We have trainings for PDO thread injection. Sorry, sir. Again, we're doing a combination therapy for eye rejuvenation po. So, 83 po si Sir Pete. Meaning to say po, we can still do procedures like this even at the age of 80s. Okay. So, healthy lifestyle si Sir. Controlled blood pressure, very good blood pressure, very good blood sugar.
I'm trying to. Nilalag ko
Yes.
po yan. My
Yes.
BP every day, morning and afternoon.
Correct. So, we have done on the right side ni Sir,
Okay.
dermal filler, tornado threads, PDO threads. Okay. So, mga kasese, will continue on the other side plus the forehead area lifting when
Okay.
CSA returns. So we are now on the left side. Again, I'll be using my dermal filler. Okay. I already injected the lidocaine and made a point of entry. Using this cannula, I'll glide the cannula into our tear trough region. Ayan. So, sir, nakita na po namin yung improvement doon sa kabila. Right side po. So,
Right.
there
Okay.
was already a change made. Making use of filler and PDO threads po.
Okay.
So again, we're using Belotero hyaluronic filler to fill in into the tear trough up to the so-called Indian line. Ayan po. So yung filler natin, napakaganda. Okay, ayan po. Lamnan natin yung volume loss, volume deficit below the eye area. So this is in combination with the periorbital, infraorbital rejuvenation. Okay. So after this, we're gonna make use of our tornado. So si Sir, mas prominent ang kanyang eye bag dito sa left. So we need the tornado PDO threads to flatten this. And there's a study na PDO threads can induce lipolysis or dissolving the fat tissues po. Okay. Yes po. So, it helps in gradual dissolution of this fatty substance or tissue inside po. Yan. And of course, healthy diet si sir. Hindi masyado sa taba-taba, hindi masyado sa maalat. Yan. Napaka-importante na po ng pagiging healthy.
Hindi ako nagsosalt, doktora. Even
Yes.
patis, I don't do patis.
Very good. Correct.
I don't want prito. Yung prito, ano kailangan
No
yung
fried.
olive oil.
Olive oil, yes. Hindi yung yung mantika na animal fat.
Nakakatakot yan.
Oo nga. Saturated. So saturated fats. Okay po. So I'm inserting 1 tornado PDO threads po. I'm just gentle for Sir Pete. Yan po. Inhale-exhale lang po. So the purpose here is to leave those PDO threads inside. This is 1 tornado. 1 tornado has about 10 monofilament PDO threads. 10 monofilaments po siya naman. Okay. And I'm pulling it. Now I need the inch. So the technique here is to also push it like that. And then we need to inject it perpendicularly directly po dun sa may mga orbital rim. Yan, medyo parang acupuncture style lang po. Yan. So, some of the sharps lang po ito. Some of my patients, I give like 10 inch threads on each side. So, start ko lang po si Sir Pete ng 5. Anyway, we'll do follow-up treatments for Sir. So, pwede tayong mag-add next time. So, for now, pwede naman minimal muna since pwede naman tayo mag-follow-up kay Sir.
Okay.
So, gradual procedure. Gawin natin siyang stage-by-stage procedure po. O, yan.
Thank you so much.
Yan, right.
Well said.
Yes. Now, we'll proceed dun sa lifting, eyelid lifting. Okay po. So, we are now proceeding on the upper eyelid lifting using the 60mm spiral cog threads. And we'll be using 1 spiral cog threads to pull the upper eyelid. So, I did an exercise a while ago already and made a point of entry. So, 1 spiral cog thread for this side na po. I'll just glide into the tissues within subgaleal. So, sorry sir, some discomfort a little bit. Just to glide inside po. It's okay. Inhale, exhale. Just 1 po. And I'm almost there and that's it. So, I have 1 spiral cog and then same on the other side, we will be doing sa cut lang po to. Actually, when I pull the tissues, it's pulling upwards like that. So, as I mentioned a while ago, Sir Pete, this is a very good way to uplift po yung upper eyelid area or brow lifting din po.
Okay.
Kasi yung iba, when they do Botox, humihina yung mga tissues dito, lalo pong nagsasag yung upper eyelid, lalong nagiging hooded eyes. So, this is the best replacement for Botox po. Kung ayaw po, kasi some of my patients na ayaw po nila ng Botox sa lugar na to kasi napapansin nila na bumabagsak lalo ang mata. Okay po. Okay, we're proceeding on the left side. So, this is spiral cog again from NCOG. It is a 60mm. Purpose is to lift the upper eyelid to prevent yung sagginess or hooded eyes. Some already have droopy brows and upper eyelids. So, we're just gonna be gliding into the subgaleal plane. So, yan. Medyo may konting discomfort lang po. Inhale, exhale. We're almost there. Almost. But this is a better alternative to do upper eyelid lift. Okay, I'm done. I'm gonna pull this up. And then we're cutting the spiral cog. Okay po. So we have done another periorbital rejuvenation for our 83-year-old male guest, Mr. Pete. Okay, so initially, ang ating dermal filler and then the ultraviolet super tornado threads below the eyes, inch threads below the eyes, and also ang ating spiral calc for the upper eyelid lifting. So, kamusta naman po ang experience, Mr. Pitt?
Well, perfect. I don't have any problem at all. Masaya ako. My pleasure that very good. Si Doktora napakabait.
Salamat po.
Very good. And I didn't even feel that much pain.
Yes.
Usually, mapipil mo ang pain sa injection eh.
Yes.
Pero napakagaling. Kaya lahat ng friends ko watching on televiewers and other friends who can see me, I can recommend CSA through Dr. Contessa Salvador. Very good po.
Ayan.
Salamat
Thank you
po.
so much, and we're so happy that we were able to help you, Mr. Pitt po.
And
Ayan.
to the cameraman and the director, you're super.
Yes, thank you so much. O ayan, mga kasiyasay, narinig po natin sa ating male guest, Mr. Pete Canilao, na yung experience na ganito ay kayang-kaya. So, non-surgical, aesthetic procedures, rejuvenation around the eye area. Kahit po nasa 80s na po, pwedeng-pwede pa po. Of course, with a very good pangangatawan and health, si Sir Peter. So, napapanitili niyang malusog ang kanyang sarili. O yan, very good example po, sir. Maraming salamat po.
Salamat po, Doktora.
Yes. And sa inyo po na meron pa pong mga katanungan, you may email me at csaskinclinic@yahoo.com. Our clinic is found at the second floor of the Pure Gold Dau Building, Dau MacArthur Highway, Mabalacat, Pampanga. Our contact numbers 045-331-1117 or 0933-8609193. Meron din po akong FB page, CSA Derm Centre, or my FB Messenger, Contessa Salvador Alapag, Instagram, doc_Contessa. And ang aming mga videos po, nasa aming YouTube, only type Contessa Salvador. Please do not forget to click like and subscribe as well. So, maraming salamat, Sir Pete. Thank you so much. Okay.
Salamat, Doktora. Salamat ng marami.
We hope to see you again po. Of course, merong follow-up si Sir Pete
Yes.
dito sa kanyang treatment.
Yes.
We will still see yung further improvement kasi as time passes by, mas nakikita pa po natin yung regeneration and rejuvenation around the eye area. Again, these are safe techniques, scientifically studied, FDA approved. And of course, lagi lang magtungo sa mga certified aesthetic physicians, yung merong mga trainings na ganito and certification. Ayan. Maraming salamat po. God bless you all. So when it comes to natural beauty, you can trust the CSA Certified Skin Authority.